Good evening and welcome to our live session. Bonsoir à tous, bienvenue dans nos sessions live qui est fait par 𝐻𝐬𝐬 Sourir. Je me présente moi-même, Delphine Dela, présidente de l'association 𝐻𝐬𝐬 Sourir et project coordinator du �SMILE Breast Cancer Care Mauritius. Ce soir, c'est un honneur, un privilège qui nous est avec nous, le docteur Mansi Chowhan. Donc, je vous cause à la fois en créole et en anglais, parce que madame est en direct avec nous depuis l'Inde. Donc, what I was saying, doctor, is that I am Delphine Dela, president of the NGO 𝐻𝐬𝐬 Sourir and project coordinator of the �SMILE Breast Cancer Care Mauritius. It's both an honor and a privilege to welcome tonight's special guest, Dr. Mansi Chowhan, who will be addressing a deeply important topic, breast cancer care awareness. So before we move on to Dr. Chowhan's presentation, I'd like to briefly introduce our organization and the vision behind this project. Donc, pour tout le monde qui connaît nous, à 𝐻𝐬𝐬 Sourir, nous mission tout le temps, nous mettre nos enfants au milieu, une priorité, et nous faisons tout le temps de la santé, nos priorités. De la santé qui fait une priorité pour nous, parce que pour 𝐻𝐬𝐬 Sourir, la santé, c'est pas, donc nous pas besoin d'un casse pour gagner droit, gagner accès à des soins spécialisés. La santé, c'est un droit fondamental et irrespectif de nos ethnicités, irrespectif de nos finances, nous avons gagner accès et droit à des soins spécialisés, médicaux spécialisés, à des traitements qui sont un enfant qui les besoin. Donc, briefly, doctor, what I was saying is that at 𝐻𝐬𝐬 Sourir, our mission has always been centered on the health and well-being of children. We strongly believe that every child deserves access to proper, tailored healthcare services, regardless of their circumstances. Over the years, our scope of work has expanded. Today, our commitment goes beyond children. We stand with all individuals facing health challenges, especially those struggling to access necessary medical services due to financial limitations. In Mauritius, around 600 new cases of breast cancer are diagnosed every year, with approximately 200 deaths. These figures are alarming for us at 𝐻𝐬𝐬 Sourir, and that's why we have brought about the project of the �SMILE Breast Cancer Care Project. Our goal through the �SMILE Breast Cancer Care Project is ambitious, yet vital, which is to reduce this mortality rate to 0. Donc, ce qui m'a expliqué, c'est que dans Maurice, aujourd'hui, nous avons approximativement 210 personnes qui meurent à cause du cancer du sein. Et là, dans ces 210 personnes-là, il y a 600 cas qui sont détectés tous les années. Au fait, nous détectons 600 cas. Donc, ça va un chiffre-là pour nous, c'est terrible. Et c'est pour ça que nous avons envie de mettre de l'avant ce projet-là. Parce que nous l'ambition, les caves, irréalisable pour un 27 individu, mais pour nous croire là-dedans. Et nous avons envie de diminuer sa taux de death rate là. Au lieu qu'il y ait 200 cas, nous avons envie d'amener à 0. Our project is rooted in compassion, equity, and dignity. We advocate for the rights of patients at every stage, before, during, and after the treatment. Our key objectives include raising awareness and promoting early detection, ensuring access to medical specialists through a dedicated tumor board made up of senior consultants who will craft individualized treatment plans, supporting women's physical and emotional healing through breast reconstruction services, and above all, preserving the dignity of every woman affected by this disease. Donc, brièvement en français ou même en créole, nos buts, au fait, c'est apporter un accompagnement complet, avant, pendant et après le traitement. Et comment nous pouvons faire, qui nous l'objectif, comment nous permettre ce projet-là de l'avant, c'est bien sûr à travers une campagne de sensibilisation, de awareness, nous avons envie de promouvoir early detection. Early detection, c'est quoi ça, au fait? C'est que tout un individu aujourd'hui, nous avons envie d'une accessibilité pour qu'ils soient capables de connaître à quel moment vous êtes capable déjà détecter eux-mêmes, est-ce qu'ils ont dans le cancer du sein ou pas. early detection through specialized treatments as well. Donc, c'est-à-dire que nous pouvons mettre en place une cellule de early detection pour un monde que du venir. Et aussi, nous pouvons assurer que nous pouvons avoir un panel de spécialistes qui pour assises autour d'un board qui nous appelle le tumor board. Et grâce à ce panel de spécialistes-là, ça va tout le monde patient qui peut souffrir de cancer du sein ou bien qui peut penser de tenir un cancer du sein, je peux capable passer avec un docteur, je peux capable faire une consultation. Et après ça, si toutefois nous peut détecter qu'ils ont le cancer du sein, ben, ça va un médecin, ça va un spécialiste-là pour préparer un plan qui est spécialisé pour la personne concernée. En plus de ça, nous pouvons apporter un accompagnement émotionnel, parce que nous avons déjà dans l'association 𝐷 Sourir un panel de psychologues qui est avec nous. Et le petit plus, pour moi, là, le grand plus, comment nous pouvons dire, c'est le Breast Reconstruction Service. Aujourd'hui, beaucoup de madame qui atteignent du cancer du sein, après l'opération, après le traitement, perdent votre sein. Et pour nous, bonnes femmes, c'est ça même, à travers ça même qui, par exemple, nous pouvons donner le sein à nos enfants. C'est une affaire qui est extrêmement importante. Donc, aujourd'hui, nous pouvons redonner une dignité à chaque madame qui peut souffrir du cancer du sein. Et après, peu importe quel type d'intervention, nous pouvons aider pour reconstruire notre sein. We are not starting from scratch. Our team has already demonstrated impactful results through the Child Cancer Scheme. Pour ceux qui rappellent, pour ceux qui connaissent, nous, l'équipe, a commencé avec le Child Cancer Scheme. C'était un projet qui est grand pareil pour nous. Nous avons beaucoup d'ambition et nous réussissons à atteindre tous nos objectifs. Comment nous réussissons à atteindre ça l'objectif-là? Nous faisons une petite parenthèse. Nos outcomes, nos progrès, tout ce qui nous est arrivé, nous l'achieve, nous avons facts qui prouvent. Nous réussissons increase survival rate, c'est-à-dire monte le taux de patients, des enfants qui sont habitués décédés, qui sont habitués morts de n'importe quel type de cancer, de 17% à 71%. Et pour nous, c'est un grand succès, c'est un reversal qui nous fait, et nous on renverse la tendance pareil avec le breast cancer. With the same passion, commitment, we now take on breast cancer. Because we believe every life matters and every woman deserves a future filled with hope and health. Thank you once again for joining us tonight. Let's now hear from Dr. Mansi Chowhan, whose insights and expertise will help guide us further in this crucial fight against breast cancer. Good evening, Doctor.
Hello everyone, and a warm welcome to all the wonderful people of Mauritius. First of all, I would like to congratulate and a huge applause for 𝐷 for doing such a fantastic job and taking up a project especially for breast cancer patient. Breast cancer is indeed the most common women cancer, and there is a lot of work which involves awareness and screening which needs to be done all around. And unfortunately, because there are a lot of myths attached to this disease, a lot of stigmas and taboos that are attached, we are still not able to beat this cancer. But our goal is common, yours, the foundations and ours, that we need to beat this disease. We need higher survival rates. We need our patients to be living a normal life. So that is what this live breast cancer session is all about. So without any further ado, we can begin with our presentation. We are looking at this disease from a very different perspective today. So there are many myths that are attached very commonly to this problem. So let's try and debunk some of these myths tonight. So starting with the presentation. So you might have heard about breast cancer awareness and this disease. Many awareness activities, programs happen all around. There is a lot of information available on the internet. And there is an entire month, that is October, that is celebrated as a Breast Cancer Awareness Month. But why such a huge hue and cry about this particular one disease, and what is the relevance of this disease in our lives? That is what we will do today. So let's try and debunk some of the very common myths. A very common one is that it is a very rare disease and I should not be worried about. Why should I be attending a webinar on this disease? Why should I be doing any awareness activity? Why should I be doing a screening annually when I do not have any problem? Because this is a disease which is maybe a alien disease, I do not have to worry about this. So this is a very big myth because it's a very common problem. The threat is real. And according to the latest statistics, in India alone, we are diagnosing more than 1.5 lakh new cases. And unfortunately, because of lack of awareness and the lack of accessibility to treatment modalities and diagnostic modalities, we are diagnosing this disease at a later stage, that is stage 3 and 4. So I'm sure that Delphine, who has been working in this field, would agree that many of these patients come to us in a very later stage, in a stage 4, yes, which is a metastatic stage, and stage 3, which is a locally advanced stage. These are advanced stages. And this is a disease which can be very easily diagnosed early. But unfortunately, just because of the lack of awareness, lack of screening activities, and just the action around it makes us fall in this category. So this is a myth that you don't have to worry about this. It's a common problem. It's a real threat. And each and every one of us, be of any age, should be thinking and should be aware about breast cancer. Another very common myth is that it does not run in my family. Nobody in my family suffers from any kind of cancer or breast cancer. So why should I be worried about it? Which is again a myth, because breast cancer, which is caused due to genetic factors or that are familiar or because of some family history, is only 15 to 20%. Rest all that happens is because of the lifestyle or environmental factors. So very common question which a lady sitting in my clinic recently being diagnosed with, unfortunately, with breast cancer would ask is, what is the cause of this cancer, doctor? So can you tell me why this happened to me? So unfortunately, medical science does not know the exact reason or the cause of breast cancer. But what we do know are the risk factors. Risk factors as in if we involve or indulge, or if we have certain factors like these, the risk of getting breast cancer increases. And one of these risk factors is the faulty genes or the genetic mutation, which can happen only in 10 to 15% of breast cancer cases. The rest of all are because of lifestyle or environmental factors, which we will discuss further in this presentation. So these breast cancer risk factors can also be classified into modifiable or non-modifiable. So non-modifiable is something which you cannot do anything about, is female gender. So it is more common in female, but yes, it does happen in males as well. It is rare, but it can happen. And then increasing age, any personal or family history, any genetic syndromes, and certain races, ethnicities, and the breast densities. And the modifiable factors are the important factors which we will focus on today, is because something which we can do about it. These are the factors we can control. And the most important factor of all these is the hormonal exposure. So the estrogen and progesterone, the very important hormones in the female's body, they have a very complex interplay. And these hormones, the excessive exposure of such hormones can actually increase the risk. So how can that happen is by using any hormone replacement therapies, that is taking these hormones externally, using any birth control pills, and also through lifestyle factors. So estrogen, which is, it promotes the cell growth. It is the red or not so friendly hormone for us. By the increased exposure of estrogen, the chances of developing cancer increases. And this estrogen exposure can increase when the start of menses is early, or when the stopping of menses, that is menopause, is late. So the years of exposure to estrogen increases, and hence the chances of getting cancer also increases. Then activities like indulging into alcohol consumption, smoking, obesity, lack of exercise, and stress. All of these factors can increase the estrogen levels in a woman's body and hence increase the chances of developing cancer. And the green, that is the friendly hormone, that is progesterone, it causes cell maturation and stabilization. And this hormone increases by timely pregnancy and also by proper and adequate breastfeeding. So these are the protective factors, and they can actually help in help us getting a maturation of cells and causing the terminal maturation or stabilization in the breast gland cells, and hence reduce the chances of getting breast cancer. Now, the lifestyle factors, which we all know and we have been talking about it for years now, is eating unhealthy food and smoking and drinking alcohol. So all these factors, apart from getting many other problems like being obese or cardiac problems, diabetic and metabolic syndromes, and hypertension, these factors will also increase your risk of getting breast cancer. So these have been proven by multiple studies on millions of women, and hence establish that all these can also increase your cancer risk. So an important factor which you need to consider here, which needs to be changed, is looking at nutrition, what you are consuming. I hope all of you know what a balanced diet means. I do not have to explain it to you, but you just have to follow, eat more fibers, more vegetables, more colors in your diet, and less of refined carbohydrates and unsaturated fatty acids and processed foods. So processed foods are those that have a lot of preservatives, and move towards a more natural diet. And a very important mention here about yoga is because a very recent study from a very reputed cancer institute in India has shown that the women who were diagnosed with breast cancer and were taking treatment and doing yoga as well had a reduced chances of the cancer coming back, that is called recurrence. So just imagine, for women who were already suffering and dealing with cancer and its treatment, they could benefit so much from yoga. So how much we could gain if we start including that in our life. So now coming to the genetic factors, which is very rare, that is 10 to 15%. But still, if it is there, if you have a family history, then certain genetic tests can help you determine your risk. These tests are to be done with pre and post testing genetic counseling always. So remember that this is not an over the counter kind of a test that you go and get a test done from a lab. This test should be done with a genetic counseling before you even get tested. And there are multiple gene and genetic options which could be tested. And if such a gene is positive, then we can do a certain preventive treatment or procedures like prophylactic mastectomies and removing of both the ovaries. So very famous celebrity Angelina Jolie was diagnosed with this BRCA1 gene mutation. She had a family history. Her mother died of breast cancer. So did her grandmother. So at a very young age, she tested and she was positive. And she also went ahead and did a risk reducing or a prophylactic surgery just so that she should not die of this disease. So this is a very radical and brave step that she might have taken being in the industry. But there are even other options like high risk screening and surveillances that we can do if such a gene is positive. So moving on to another myth is that I cannot do anything to reduce my risk. So if breast cancer is so common and it can happen to anybody, irrespective of the family history, then I should lead a normal life. I should not be thinking about it. What can I actually do to reduce my risk? This is a very common myth again, because you can do lots. As we have already discussed that we can work on our lifestyle factors. It is important that we eat a normal diet, a balanced diet. It is important that we maintain a healthy weight and restrict the alcohol and smoking consumption. But at the same time, what every woman should do, irrespective of the age, is a self-breast examination. This is something which is a very powerful tool. It is something for which you do not have to go anywhere. You do not have to meet any doctor. It is something which you do for yourself as a part of your self-awareness. So self-breast examination, what should we look for in this examination is lumps that feel different from the rest of the breast. There could be changes in the size, in the shape of the breast, in the contour of the breast. There could be a little dimpling or a little bulging of certain area in the breast. Then there could be a rash around the nipple, or changes in the skin. It could become red with discharge, or there could be tenderness of the breast. So this self-breast examination can be divided into two basic sections, that is inspection, that is to see, and palpation, that is to feel. So inspection is nothing but you with your shoulders straight and your arms over the hips, you are just looking in the mirror and inspecting or looking for changes that we discussed before. Any changes in the shape, size, any dimpling or puckering, any retraction of the nipple, any changes in the skin. Same thing you do with your arms raised. And then you also look for any discharge coming from the nipple. Then the next section is to palpate, or palpation, or to feel. So while lying down and using the first few finger pads, not the palm of your hand, but the few finger pads with small circular motion, you have to check the entire breast area. So the entire breast area is from the collarbone, that is the clavicle, to the upper part of the abdomen, and from the cleavage to the armpit. So it is very important that you include armpit region as well while you are examining yourself, because sometimes you might not feel a lump in the breast but in the armpit region. So all of this has to be done. This can be very easily done when you're taking a bath, because your hands are already slippery, and it should be done only once in a month, and generally after your monthly periods are over, because just before your periods or during your menses you can have you can feel some discomfort or tenderness in the breast. So it is always better to check yourself after your periods are over. And you can just mark a date on your calendar that this is my date of my self-breast examination. In case if you feel any lump, please do not panic, because there are many other kinds of lumps as well. Not all breast lumps are cancerous. There could be non-cancerous lumps, and 80% times when you do a self-examination and find something, it is going to be a non-cancerous or a benign problem. So do not panic, but at the same time, it is very important that you see the doctor. Now, moving on to a very common myth, a very relevant myth in this time, because with a lot of information available over the internet, sometimes women do ask me that mammography can increase the risk of breast cancer. So this is such an important topic, because mammography is a tool, is a screening tool which helps us detect cancer early. So it is important for all the women who are more than 40 years of age to get a mammography done once in a year. And mammography is nothing but it is like an X-ray of the breast. And it takes hardly 10 to 15 minutes to do this test. And this test is very vital for us to know this disease at a very early stage. And the myths around it is that this radiation would actually increase your breast cancer getting risk. And this is a myth, a misconception. The radiation involved in this test is not going to increase any risk for you. So please do not hesitate to get a mammography done just because some article on the internet has suggested otherwise. It's a very easily performed test. It takes hardly 10 to 15 minutes. And it's important because just doing your examination, just going to the doctor and they doing your examination, that's a clinical breast examination, will miss most of the times very early stages of cancer, and our entire purpose of doing the screening would be defeated. So mammography is very important. There are certain new novel modalities that are also available these days. One of these is thermalytics. It is like a thermography. It's a thermal image of the breast, and it is then analyzed by AI software, and a reporting is done. This does not involve any touch, any pain, any radiation, and even the woman is sitting in a chamber which is totally screened, and she's sitting there alone. So this could be repeated, and this could be done for women of all ages, unlike mammography, which is done only after 40 years of age. So these are the newer kinds of modalities available these days. So moving on to our next myth, that is, are all breast lump cancerous? So they're very commonly, especially younger women, found on their self-breast examination, found a lump, and they would come in a very anxious state saying that, doctor, I have breast cancer already. So not all breast lumps are cancerous. There could be so many other lumps which could be there, and these kind of lumps are called benign or non-cancerous lumps, depending upon your age and at the cycle of your breast. There are multiple kinds of lumps can be there. So when the breast is developing, that is during your early growing ages, there could be lumps like fibroadenomas or juvenile hypertrophy. And then during the cyclical activities, that is during your monthly changes of hormone and hormone cycles, cyclical mastalgia, that is the pain and cyclical nodularity, can appear. So some women might experience some nodularity or some lumpiness just before the menses, which disappears after the menses. So these kind of cyclical activities are linked to the hormonal cycles. And involution, that is aging, at that point of time, again, certain other kinds of breast problems can happen, like breast cyst and ductal ectasia, which is the duct dilatation, which might cause some nipple discharge. And during lactation or feeding, breastfeeding, breast milk abscesses and mastitis, that is infection of the breast, are very commonly seen. So like any other organ in the body, breast can also have multiple problems, and not all problems, not all lumps can be attributed to cancer. So if diagnosed with any of these lumps, the treatment is very simple, and sometimes only by medication, and sometimes with a very small surgery, a minor surgery, and you can be all right. But in case if you have a lump and the doctor has suggested you to get a biopsy done, so this is another myth which is very commonly heard about, is that doing a biopsy can cause the spread of cancer within the body. So very commonly people think that if we try to touch that tumor, or if we try to fiddle with it, if we try to poke it with a needle, then the cells will spread, and it can actually cause spread of the disease to other organs or within the breast, which is again a myth. So for any kind of breast lump, there is a triple assessment which involves clinical examination, that is the doctor examining you, and then imaging, that could be a mammography, that could be an ultrasound, that could be a thermography, that could be MRI, and then the tissue diagnosis, which is a very important step. And this tissue diagnosis is the confirmatory step. Without doing this biopsy, without taking the cells or the tissue from this tumor and looking at them under the microscope, no diagnosis can be confirmed. So a breast cancer diagnosis is only confirmed when we do a biopsy, when we look at these cells under the microscope, and only then we can be sure that this is indeed a cancerous lump or not. So do not hesitate, and do not let this misconception get into your treatment process, just because this has been done for decades, for years now, and it has been proven that it will not spread just because we did a biopsy. So a very common myth, again, moving on, that is once diagnosed with breast cancer, the treatment of breast cancer involves complete surgical removal of the breast. So unlike many other cancers, like for example, if there is a cancer in the kidney, then the kidney has to be removed. Or if there is a cancer in the gallbladder has to be removed. So unlike such organs with breast cancer, you do not have to do an entire removal of the breast. This is a misconception. And also breast cancer treatment or management is not a one doctor or a one person's job. So let's talk something about how breast cancer treatment is done. And it is a very comprehensive or a multidisciplinary approach which is there for breast cancer treatment. It involves the surgeon, and it involves medical oncologists, where you will receive chemotherapy, targeted therapy, hormonal therapy, and then the radiation therapy. Then there are allied specialties as well, like radiology, nuclear medicine, and pathology, which help us to know about this disease better. And then the supportive specialties like physiotherapy, nutrition, clinical psychology, and cancer rehabilitation. So all of these teams and all of these doctors, when they are united, they form a tumor board, like Delphine was telling you earlier. And this tumor board actually helps you to achieve better survival and cure. So it's not a one doctor's job, it's not a one-man army, but it's an army of doctors that is required. So let's talk something about the surgical aspect of breast cancer treatment. So long back, maybe 70, 80 years back, the procedure which was done was very radical, was almost, I would call it as an amputation, was a complete removal of the breast. And it was done even more radically before, and then a modified radical mastectomy procedure was devised. But this was in the past. This was the only option which was there for ladies then. But then now losing is not an option anymore. We have breast conservation surgeries where we just have to remove the tumor and the rest of the breast can be preserved. And these surgeries can also be enhanced with the oncoplastic procedures. So oncoplasty consists of two words: onco, that is cancer removal surgery, and plasty, that is the plastic surgery techniques which can maintain the shape and the symmetry of the breast at the same time. So the women has to only get rid of the tumor, not of the entire breast. So we say that if a lady is being treated for breast cancer, they should the battle is half won if we are not able to preserve the breast. So many kinds of oncoplastic procedures can be done. There are more than 100 procedures that can be performed based on its complexities. It could be level 1 procedures with smaller incisions, with only mobilization of the breast tissue, or there could be level 2 oncoplasties that is more complex procedures of mammoplasties that are involved in them, and sometimes a flap surgery, that is some fat taken from around the breast or from the muscle, or sometimes a full breast reconstruction can also be done. So all these procedures are very commonly performed. The safety of such conservation surgery has been established. There have been hundreds and thousands of researches and evidences that support that a breast conservation surgery is equally safe. So if you have any doubt in your mind that maybe if we leave rest of the breast, then the disease can come back, so please do not hesitate to talk about it with the doctor. So always know when you are seeing your doctor, always discuss about the options of complete breast removal. Of course, that is an option. Then breast conserving surgeries, the oncoplastic surgeries and reconstruction, and also the complete breast removal and a breast reconstruction at the same time. So before going ahead for any kind of surgical option, you should discuss all these options available to you at that point of time. So moving on, last myth, that is breast cancer cannot be cured. So, which is again a myth, gladly, because breast cancer, yes, it can be cured. Once diagnosed with diabetes or hypertension, maybe you will have to take these medicines lifelong. But once diagnosed with breast cancer, you have to take the treatment, you have to complete your entire course of treatment, and then you can be cured and you live an entirely normal life. So our patients who got treated 10 years back, they live a very normal, fulfilling life, and you cannot differentiate them from any other person. So these patients also have a pretty much normal life, even during the treatment, I would say. So after the treatment, when they get cured, they are living as normal as anybody else. So it is not, breast cancer diagnosis is not a death sentence. There is a lot of hope, even with stage 4 cancers these days, with a lot of molecular and precision oncology available. We are able to give them a very good survival rates and a better quality of life as well. So the only way where we can beat this disease is through early detection, and this early detection then translates into a better survival or cure rate. You would be surprised to know that if we detect this disease early, that is in stage 1, we can have as high survival rates as 98%. So this is a very high survival rate, and the only window where you and me and our foundation can help is in detecting these patients early, detecting in stage 1 or 2, so that we can deliver high cure rates to our patients. So again, there is a very different scenario which we in India and in Mauritius, the developing countries, we face as compared to the Western or developed world, is that they have national programs for screening. So every year they will get an envelope from the government that this is your date of mammography and you have to come and do it. But in our country, we have to do screening on our own. But before that, we have to also be aware about it, because sometimes, why are we diagnosing these patients in stage 3? Because even the woman who has a lump in her breast hesitates and is not aware to go and get themselves checked. So we are lacking into awareness as well as screening in our countries. So this is where all these activities of awareness and the activism can help. Our problems are different, so our solutions are also different. Our solution requires more awareness programs like these. It requires killing the myths and the stigmas that are attached with it, and making the diagnosis and the treatment accessible and affordable. So finally, just 3 tips from my side to beat this disease, breast cancer, is first to know the fact, know that it is a very common disease, know that it can happen at any age. I have treated a girl as young as 18, 16 years of age, and also a lady at 94 years of age. So no women or no age cutoff is there for this disease. And even men can have breast cancer. So know these facts. Know your additional risk factors. If you have any family history, if you are indulging into any of these lifestyle factors that we talked about, if you have taken or have been exposed to external hormones, if you are indulging into alcohol or smoking, if you are overweight. So all these are additional risk factors to you. Then protect yourself. So all of this awareness talks goes into vain if we do not take any step against it. So after this awareness presentation, after knowing everything, if you do not check yourself, do your self-breast examination or get yourself checked once in a year, then all of this goes into waste. So any awareness activity must be followed by action which is taken by you. So it is very important that you do that. So this is our comprehensive oncology team at Fortis Hospital in India, in Manesar. So we have all the specialities. We have an organ-based surgical oncology team. So we have different specialists for different organs. So we have a specialist for GI, that is abdominal cancer, that is Dr. 𝐕𝐵𝐚𝐳𝐚. Then I am taking care of the breast cancer in the department. Then we have Dr. Vineet Kaul, who is a head, neck, oral cancer or thyroid specialist, and Dr. Jyoti Bhatt, that is a gynae oncology specialist. Dr. Pooja Babbar, who is a medical oncologist. So, and also all our colleagues and related doctors and the supporting staff, we all make a comprehensive team, and we believe in hand-holding our patient throughout the journey. So once diagnosed with cancer, we have a everlasting association with our patients. So we have over 10 to 12 years, we have treated many patients from Mauritius, and gladly we could make a difference in their life. So thank you so much for connecting with us today, and we would be glad to answer any queries, any questions regarding this subject. So over to you, Delphine.
Thank you. Thank you once again, Dr. Chowhan, for such an insightful presentation. In fact, in Mauritius, we have many people thinking about myths. What if, or can we do that, or can we do this? And this is regarding the lack of information. So I believe that your presentation has been really explainable, and many people have gained the maximum of information. Before we proceed, we are going to move on to our Q&A segment. And we had some questions that already had their answers in your presentation. So it's a good thing. For instance, we had a question such as, does the radiation from mammography increase the risk of developing cancer? And you perfectly answered. So it's just a myth. And people are too scared.
It is so common these days. Yeah. Exactly. So the first thing which strikes your mind is to check on the internet. And the internet is actually filled with a lot of unfiltered information. So if you try to search headache on the internet, it can tell you have brain tumor. But you know that not all headache is because of brain tumor. So similarly, there are many myths regarding radiation as well. And this unfiltered information can actually prevent you from being diagnosed early. So it's always better to discuss it with your doctor. So you can ask your doctor as many questions as you want, and open communication is always welcomed. It is always better than going to the internet for such answers.
Yeah. So I have some more questions from people who are seeing our live. One question is BRCA1 and BRCA2 tests always reliable?
Yes, so the BRCA1 and BRCA2 are two genes, and we are testing for any mutation in these genes. So it's a very important, very good question. So before you get any genetic testing done, first you need a genetic counseling. Why is that genetic counseling important? Is because a complete pedigree chart is made of your family. Before you go ahead for any testing, what are the types of cancers that run in your family would be taken into account, and based on that your risk is decided, and then what type of genetic testing you should do is also decided. So it is not always that you should do only these two tests, that is BRCA1 and 2. The international recommendation is to do an entire panel of genes. That is a hereditary breast and ovarian cancer gene panel. That is a HBOC gene panel. And they're roughly around, depending on different labs, there could be around 50 to 70 genes that are covered in this. So these two are the most commonly talked about. The BRCA1 and BRCA2 gene are more commonly talked about genes, but there are other genes involved as well. So an entire panel is recommended. And also the counseling is required because you should know about the implications of the results. So if a gene mutation is positive or if it is negative, and sometimes there is an ambiguous result as well. So in such circumstances, how would it impact your life? is something which you should understand before you go ahead with the genetic testing.
Yeah, sure. Thank you very much, Doctor. We take another question from Anuksa, who's asking, does hormonal tabs help us and reduce our chance to get breast cancer?
Yeah, so hormonal tablets, that is external hormonal supplementation, either in the form of hormonal replacement therapy or as a part of birth control program or contraceptive pills. These can actually increase your risk of getting breast cancer, not reduce. But the other part of hormonal tablet, that is the hormonal therapy, that is a therapy which is used to treat breast cancer patients who are hormone positive. So do not get confused with the hormonal therapy. That is a therapy or a tablet which is used in breast cancer patients to prevent their chances of recurrence. But the day-to-day hormonal tablets that we are talking about, the progesterone pills or the estrogen pills, are used as a part of hormone replacement or used as a part of contraceptive method, is something which should be avoided.
Okay,
so the long-term use should be avoided. Yes. Always speak to your gynecologist and know your risk if you are taking certain pills.
Yeah, thank you. We take another question. Any advice how to reduce fluid in my daily routine? And the person said that your answer would help me a lot. So whatever I'm going to say, you might think that this is a very cliched response, but that is what you need to do. So balanced diet, eat healthy, and at least regular exercise, physical exercise, at least 3 to 4 hours in a week, and maintain a healthy weight. And also know your risk, do your routine screening. So very commonly people do regular blood checkup because they want to know their sugar levels, thyroid levels, and so on. But screening specific for cancers and especially breast cancers is missed in that. So many corporate companies have packages of screening their employees once in a year, but the cancer screening is sometimes not included in it. So first, eat healthy. Second, do your regular exercise, maintain healthy weight. Try to reduce alcohol, smoking, and the stress levels. Do your regular annual screening, and also have try to make a good exercise or a yoga included in your routine. So all of this can actually help you prevent breast cancer. Okay, thank you. And I'm going to take a last question, Doctor. So is breast removal surgery, such as mastectomy, safer in terms of preventing cancer reoccurrence?
Yeah, this is again a very common myth because people think that if we remove the entire breast, then the cancer will not come back. But even when we do an entire breast removal surgery, 10 to 15% of the breast is left behind. And there could be cancer recurrence even after a complete breast removal surgery. So a mastectomy, that is a complete breast removal surgery, does not ensure 0% cancer recurrence. So the cancer recurrence is more dependent upon the nature of the tumor, that is the tumor biology, how aggressive the disease is. And this recurrence or cancer coming back can happen within the breast, or it can also happen in any other part of the body and not in the breast. So breast conservation surgery is very safe. And whenever we preserve the breast, we also combine it with the radiation therapy. So the conservation surgery along with the radiation therapy gives us excellent results in terms of reducing the risk of recurrence of cancer in the breast.
Thank you very much. Thank you, Dr. Chowhan, for these clear and compassionate answers. I'm sure our viewers feel more empowered and informed after hearing you. To everyone watching, remember, the journey through breast cancer is one no one should walk alone. Donc, ce qui nous peut dire, c'est que breast cancer, le cancer du sein, c'est un combat qui n'est pas capable d'amener tout seul. Nous là, nous avec eux, nous pour accompagner eux, comment me dire, avant, pendant et après. à travers le awareness, à travers tout ça, ban tips qui Dr. Chowhan de nous là, souvent à l'île Maurice, nous pensons, moi, mon pas qu'à gagner cancer, ou bien mon maman peut gagner un lump, mais mon pas connaît quitter ça. Nous attendons trop tard. Donc, si toutefois, je peux découvrir un petit lump, ou si toutefois, je peux sentir qu'il y a un affaire qui est bizarre dans l'ICO, mais n'est qu'à faire un check. N'est pas coûte non, n'est pas coûte zut non, et aussi, through the awareness, early detection and support, we can change the story. If you have more questions or need help, please reach out to us at 𝐷 Sourir, demand section Smile Breast Cancer Care Mauritius, and we invite Mopé termine ce live. I invite everyone to our Pink Music Day concert dedicated to women suffering from breast cancer, which will be on Friday 20th at 𝐷𝐵. Ce qui m'opé dire, c'est qu'il m'invite de tout. Qui dit madame, qui dit monsieur, petit, grand, de tout vin en nombre. Le vendredi 20 juin à 𝐷𝐵. Nous pouvons faire un concert spécial à l'occasion de la fête de la musique. Que nous pouvons faire un concert pour venir en soutien, venir en aide à tout ban madame qui peut souffrir du cancer du sein. Donc, c'est un concert qui est gratuit. Vous venez joindre l'équipe qui pousse sur place pour qu'on demande n'importe quelle information qui est pour besoin. Nous pour là, nous pour en force avec vous. Et c'est ça mon mot de la fin. Thank you very much, docteur. Merci du fond du cœur de toute l'île Maurice, de tous les membres de l'association, de toutes les personnes qui sont derrière ce projet. Et if you have anything to add.
So thank you so much for hello Nutan, and
thank you Dr. Mansi for giving such good presentation. I think we have learned so much, and there was so many myths which really don't know as a common man. And I thank Mr. Karan and his entire team this possible. I'm sure we will have some more programs, and these are going to help for us and for our Mauritian friends. Thank you.
Thank you so much, Nutan, for inviting me. Thank you, Delphine, for such a wonderful session, and all the viewers. Thank you so much for your interest in breast cancer awareness. And there's only one promise which I would want you from all of you is to do your self-breast examination, be breast aware, and take necessary action today itself. Thank you so much and have a lovely evening.
Thank you.